I'm an appendix cancer patient with goblet cell. It's moderately differentiated mucinous adenocarcinoma, and there is a less aggressive pathology known as LAMN, L-A-M-N, and then there's a more aggressive pathology called signet ring. And now, unfortunately, because it's such a rare disease, a lot of doctors and oncologists will say things to LAMN patients about how it's benign or it's not cancer, and just kind of write a lot of things off. And unfortunately, while yes, it's the least aggressive form of appendix cancer, it's still cancer. And there's just a lot of misconceptions that if somebody is diagnosed with LAMN, that all they need is just their appendix removed. And I don't want to scare anybody, but I want to make sure everybody gets the proper care and attention that they deserve and need for quality of life. So if you have been diagnosed with LAMN and somebody says it's not cancer and that you're good and you could just go live your life and not ever think about it again, please, please, please find a specialist. And in our community, a specialist is always a surgical oncologist that specializes in appendix cancer. And if you don't see appendix cancer or PMP on their page with their contact information, if they say they specialize in colorectal cancer, run. It's not the same. It is absolutely not the same. You need somebody who deals with appendix cancer on a daily basis, who has done CRS and HIPEC hundreds, preferably thousands of times. That's all they do pretty much. Even if you don't need surgery, these surgeons are the ones that see this disease more than anyone else, and they need to be the ones guiding your treatment plan and in charge of it. And you need a whole team. So you need the surgical oncologist, you need a medical oncologist, you need your primary, you might need other specialists like a gastroenterologist and so on and so forth. But please, if you have been diagnosed with LAMN and your doctor or doctors seem to be really comfortable and tell you that you're good, please make sure that you find somebody who is going to listen to you in case you do have problems. And you may be okay with just having your appendix removed, and that's great. And that's what we all hope for. But please make sure that you have the right team that's not going to write off any symptoms, possible recurrence, possible spread. Please make sure that you are properly being monitored. You should be getting imaging on a regular basis, at least for a few years, to make sure that there are no tumors growing anywhere else or any other issues. So that's just my take on it. I'm not trying to scare, I just want the recognition that even LAMN deserves, and that as somebody with a more aggressive pathology, I have seen many patients with LAMN that suffer more than I have because their doctors have basically ignored and not properly monitored things, and symptoms go ignored, and it's just assumed that it's all in their head, and it shouldn't be like that. You had your appendix removed, or you've even had CRS and HIPEC. You need the right attention, and I just want to make sure that everybody in our community gets that. So that's my 2 cents on appendix cancer, LAMN patients. I would hate to see somebody have to suffer more than necessary because they didn't get properly monitored or the proper care. So good luck to you. If you need more information, it's all out there at acpmp.org and pmpals.net. So make sure you get the proper care and attention that you deserve.